We are Team MCH, presenting NF1 drug targeting for benign and malignant tumors. Our team consists of Matthew Zamora, Ashtha Naik, Chang In Moon, also James, Paul Zamora, and Richard Conroy. NF1 has a lack of treatment options, and cancers are part of that problem. Neurofibromatosis type 1 has no commonly accepted drugs for adults. NF1 has diverse lists of cancers, and these cancers can occur throughout their lifetime, so it can mature into a malignant cancer from a benign cancer, for example. So we've provided a list of possible drugs and gene knockout targets for NF1, and in particular we also explored the malignant cancers and what some of those targetings might be. So we took a two-step approach. First, we did broad NF1 therapeutic targets, looking at primarily benign NF1 cell lines, and then we took a deeper dive at malignant cells. So looking at the benign cell lines, there were 6 benign cell lines in the high-throughput screening data that we had, and we were able to also look at a normal reference cell line, which was human foreskin fibroblasts, and we were able to determine a relative potency of a drug relative to that normal. So was it more potent or less potent than a conventional cell line? And based on that, we were able to create a ranking score and a rank sensitivity based on how many of the 6 cell lines were responsive and in what direction. Following that, we looked at chromosome 8q gain. We noticed a trend from prior literature where certain flavors of cancers are known to have this gain. It is known that a variety of cancers are more lethal on average in NF1 patients, and also they tend to form earlier. Among these are malignant peripheral nerve sheath tumor, ovarian cancer, and also melanomas. It was shown previously that malignant peripheral nerve sheath tumors have chromosome 8q gain most often, and it was derived in this research that also melanomas and ovarian cancers show that same trait. So looking at that, we were able to devise 2 data set cohorts for chromosome 8q gain and chromosome 8q no gain. Based on that, we were able to use area under the curve scores from drug screening data. We had over 100 cell lines and 1,448 drugs. We then did a Wilcoxon rank sum test between the chromosome 8q gain cohort and the chromosome 8q no gain cohort. We performed non-parametric statistics for comparing medians for the non-normal outcomes, and based on that we were able to set up a list of drug names associated as potential targets for the malignant tumors that are common and more severe for the NF1 genetic disease. Thank you very much.